Okay, so hi everybody. I am Nikos Scarmeas from the National Kapodistrian University of Athens. I'm not sure whether Yannis Sotiropoulos would like to start, or maybe I can start as the chair.
Go on.
Okay, thanks, Yannis. So today's teleconference, today's meeting, I should say, because there will be a discussion afterwards, is titled Dementia and Cognitive Disorders in Remote Areas of Greece, the Potential of Telemedicine Evaluations. Okay, so there will be two parts. In the first part, we will describe some telemedicine evaluation of neurological patients with cognitive problems. And it will be from the receiving end, so it will be the evaluations of people who have problems. And then the second part, I will talk about maybe about the potential to refer many of these participants through the mobile medical units of the Stavros Niarchos Foundation, an initiative that has been going on for quite a few years, and may be able to funnel patients towards the telemedicine evaluations that take place in Athens, but maybe in the future elsewhere. Okay, so we will start with Thaleia Angelopoulou from Aiginitio Hospital. Thaleia works with Socrates Papagioris, is with us also. And she's the neurology in the telemedicine clinic here at Aiginitio. Thaleia?
Thank you very much for the invitation to this very interesting session and the opportunity to present our experience from the outpatient clinic for memory, dementia, and Parkinson's disease through the National Telemedicine Network in the First Department of Neurology in the Aiginitio University Hospital in Athens, coordinated by Professor Socrates Papagioris. Firstly, we would like to briefly describe the National Telemedicine Network of Greece, which was developed by the Second Regional Healthcare Administration of Piraeus and the Aegean Islands in 2016. It includes at least 57 telemedicine stations in regional health centers of the Aegean Islands, and it aims to provide video-based synchronous medical support of various specialties, thereby overcoming geographical barriers with high-resolution cameras and screen through SysAccess, which ensures data security. Our unit was developed in March 2021 from the specialized outpatient clinics for dementia and movement disorders in the Aiginitio Hospital in collaboration with the National Telemedicine Network. And the aims of this tertiary telemedicine unit are firstly to provide equal specialized care to patients with cognitive or movement disorders. Secondly, to contribute to the education of the healthcare professionals of the periphery. And thirdly, to investigate if this model is feasible and effective in Greece. These aims are in accordance with the three pillars of the telemedicine definition as defined by the World Health Organization. Our unit consists of a neurologist, neuropsychologist, and psychiatrist specialized in dementia. We ask some basic information to be pre-filled by the doctors in the periphery. And the structure of our visit includes the medical history, neurological, neuropsychological assessment, and instructions for further follow-up. There is a lot of official guidelines specifically for the neurological examination for patients with cognitive or movement disorders through telemedicine, but there are some general recommendations from the AAN and some studies regarding the feasibility and reliability of specific scales like PDRS Part 3. And based on the literature evidence and experience, we have selected some the parts of the neurological exam that we do remotely. For Stansigate, we ask the patient, for example, to walk preferably at least 5 steps from the side of the room to the other in directions. For tandem walking, if there is a third party, for safety reasons, we also perform this exam. For cranial nerves, we do smooth pursuit and saccades. For motor examination, we firstly examine resting, postural, and intention tremor. Then for bradykinesia, finger tapping, pronation, supination, and if Parkinsonism is detected, then we perform UPDRS Part 3 apart from the rigidity and pull test. We don't do usually sensory exam, and the ordination does not need any specific adaptations. Now, during these 3 years, we have totally performed 184 telemedicine visits. First visits, from then, the first visits were 107, and 77 were follow-ups. At least 6 of them were from referrals from mobile medical units and 4 from the program Health for All, from Professor Scarmeas and Professor Papageorgiou, respectively. And the vast majority of the disorders were cognitive disorders, and the island with the most referrals was Rhodes. During the first 2 years, the patients, caregivers, and healthcare professionals mentioned high levels of satisfaction regarding these telemedicine aspects that we examined, as we can see here. In 2022, our unit also won the first prize in the competition of Ministry of Digital Governance. And some barriers and challenges that we have detected. First is the absence of the legal framework, the limited awareness of the residents of the islands about the medicine services, the lack of official guidelines, as we said, the limited engagement of the GPs of the centers of the islands, and the fact that stronger collaboration is needed with the local municipalities. So towards... Yes, I have only 2 slides. So towards this direction, we plan to perform on-site visits by our telemedicine team to inform the doctors there about our unit, to enhance our collaboration with the other societies, and to continue and improve our unit. So our unit, Professor Papageorgiou has received funding for the research program called Telecognition, which aims to contribute to the development, assessment of an innovative telemedicine model for patients with cognitive disorders in the remote areas, funded by the HFRI. And this is the plan of this research project, which we don't have so much time to see in detail. And thank you very much for your attention.
Okay, thank you, Thaleia. So let's proceed with Dionysia Kontaxopoulou. Dionysia is, I think, a psychologist, right? A neuropsychologist, and she will tell us a little more about the neuropsychological evaluation that you perform in Aiginitio Hospital at the telemedicine unit.
Okay, I'm trying to share my presentation. Is it okay now?
Yeah.
Okay, perfect. So, good evening to all.
Can you make it full screen, maybe?
Yes, I just did it.
We're not seeing it as a full screen, but maybe you can proceed, because I mean, I don't know about it's lit,
Okay.
so, yeah.
Thank you very much for the invitation once again. Following Thalea's presentation, I will present briefly our experience regarding the neuropsychological assessment of patients with dementia and cognitive disorders through the telemedicine outpatient clinic in Aiginitio Hospital. Teleneuropsychology is defined as the remote assessment of patients using technological equipment.
Yeah, the slides do not advance.
Okay, I'm going to share my screen, not only the PowerPoint presentation.
Yeah.
Okay.
Yeah.
So, teleneuropsychology is defined as a remote assessment of patients using technological equipment that began to be applied more systematically during the COVID-19 pandemic, and studies have supported good validity and reliability in relation to traditional in-person assessment. and also several tools that assess attention, verbal memory, executive function, language, and general cognitive status have been studied for their reliability in relation to in-person assessment with satisfactory results. Regarding our evaluation, since there is no standardized protocol for the teleneuropsychological examination, we relied on general recommendations as well as on the literature evidence in order to select the relevant tools and to develop our final protocol. This includes neuropsychological tools that we administer also in the hospital clinic setting, as we wanted to design a protocol that simulates the in-person examination that is already being performed. And while there is a specific protocol, this can be also be modified according to the needs of each patient. So on a case-by-case basis, we may add additional neuropsychological tools. In total, we have examined 107 patients. 50 of them have been examined through the full neuropsychological evaluation, while 20 of them have been assessed briefly through screening tools. So far, the barriers we have identified are consistent with those reporting in the literature. Technological illiteracy, the lack of technological equipment with good quality and slow internet speed were the most significant difficulties for the outcome of the neuropsychological evaluation. And also sensory difficulties, as well as the distraction from the environment, often become a barrier to conducting the examination. And it's also important to mention that some tools have not yet adapted very well to telemedicine conditions. For example, neuropsychological tools that assess visuospatial perception and memory and visual motor coordination. And finally, as Thalia also mentioned, now we are working on a new project that aims with the aim of developing an innovative telemedicine model for patients with cognitive disorders in remote areas, where from the neuropsychological examination point of view, we tend to develop a new protocol with tools that will cover a wider range of cognitive functions, which they could be administered digitally.
Okay.
Thank you very much.
Okay, thanks, Dionysia. Thanks, very interesting. So let's try to see what the Alzheimer's Athens, how do the Alzheimer's Athens evaluations look like? So Faidra, maybe you can start from the neurological evaluation part, and then I.
Okay, hello to everyone. Let me share my screen. One moment, please. Here. Can you see this? Can you see the screen?
No.
Okay, share. Now?
Yes. Yeah.
Okay. Thank you. So, back in 2021, when the COVID pandemic started, there was a need for all physicians to change the way we deliver care. So, association, the Athens Alzheimer Association, decided to use telemedicine in order to continue to provide our services in people in need. At the beginning, we basically used telemedicine to perform neurological and neuropsychological evaluations. Sorry, the next slide. Okay, so we did the neurological examination using telemedicine with the assistance, the help of the caregiver, we understand that not all parts of the neurological examination can be performed visually, and that this kind of examination using telemedicine cannot, let's say, replace an in-person evaluation, but it was a way to continue to examine patients during the pandemic. So, with the assistance of the caregiver, we examined eye movements, asking from the patient to look in the 9 cardinal position of gaze with pose at each position. We examined if there was any dysarthria or dysphonia. Coordination was examined with rapid alternating figure-to-nose and heel-using movements. Bradykinesia testing with finger tapping and sorry, because I cannot see my screen. And opening, closing fist, and finally, gait was examined by observing stance and ability to stand with feet together, observe gait and ability to walk in tandem. That was the basic parts of the neurological examination performed by us, given the fact that all our patients are basically examined for memory problems, and if there was any kind of uncertainty about any finding, they were referred for an in-person examination. So, starting from pandemic association, the Athens Alzheimer Association went through a totally digital transformation, offering today many online services. On the screen, you can see the number and kind of services provided. There are online consultations to caregivers, online via phone consultation people with dementia, online group individual sessions with non-pharmacological interventions. We have online prescriptions, patients examined by telemedicine, and neurological evaluations again by telemedicine. Angeliki Tsapanou will talk to you about this part of our examination. And finally, I would like to also say it is very important, and we are very proud to have this kind of services, that we have mobile units that provide home services. There's a mobile unit at the day center in Neo Iraklio that serves basically most of the area of Athens. There is a day center in Piraeus, a mobile unit day center of Piraeus that not only serves the area of Piraeus, but has visited many islands in the Argos. And finally, there is a mobile unit at the day center in Arta, which provides services in many remote villages in the area. All that is made with the help and the collaboration of local GP and physicians. Thank you.
Faidra, quick question. It's not the time for questions, but just to clarify, can you go to the previous slide? What's the difference between evaluation, consultations of patient dementia? 3,000. What's the difference? You say consultations online and people examine with telemedicine.
Nowadays, we don't use telemedicine because people can come and have an in-person examinations. But there is a phone line that works for many hours during the day that caregivers and patients can call and take some kind of like guidance. Sorry?
So it's through the phone. It's not
online. No, it's only online. It's correct that it says online, but it's not a cognitive or a medical evaluation.
Yes.
It's more informative.
If in the form of a consultation, giving guidelines or asking about our services, any kind of information request for them.
Okay.
Or also we provide like CT sessions or more therapeutic, especially for the caregivers. Consultations.
Okay, that's separate. Okay. Maybe we'll go to your presentation then. Sorry for the interruption.
can you see the slides?
Yes, yes.
Okay, so and continues to Faidra, I will present you our results regarding only the neuropsychological assessment of older adults on the Alzheimer's Association. As Faidra mentioned, we have the already new also daycare centers at the Athens Alzheimer's Association in different places of Athens, like Tsapanou, Marou, Sicilian, and new ones like Aspropios, Iraklion, Athens, and the newest town, Piraeus. And now we also started outside of the Attica area, such as the one in Arta. Due to COVID-19, we started performing neuropsychological assessment online, and we published this paper on applied neuropsychology regarding remote neuropsychological assessment of older adults. And this was an initiative of the Athens Alzheimer's Association in collaboration with the Hellenic Neuropsychological Society regarding the period of April 2020 and October 2021. In total, 90 participants took place in this study with either mild cognitive impairment or Alzheimer's disease or cognitively healthy. The mean age of the participants was 75 years, while the mean education was almost 12 years, which is quite high. And of course, women were the most prevalent with almost 70%. So the battery that we used examined not only a short global cognitive test, but also we used many different tests examining different cognitive domains such as attention, learning, memory, language, and visuospatial ability. And apart from this cognitive tests, we also give the GDS scale. Here we can see the percentage of complete assessment of different tasks by diagnostic group, while the cognitively healthy did not have any problem. MCI and the demented one faced most difficulties on CVLT and the judgment of line orientation test. As you can imagine, and as you also found on your studies, the biggest strength were that we can maximize continuity in the care of patients. We can now monitor the disease progression easily. It is quite accessible and easy to use, and it is very useful to assess patients in remote and underserved areas. However, the main limitations are external interruptions because the practitioners have to use technology. It's not suitable for patients with neuropsychiatric symptoms. Of course, the absence of face-to-face assessment is also a big limitation. And of course, we depend on the caregivers, mostly especially for the people with MCI and the demented ones. In total, however, and after the COVID period, we still continue to use a remote neuropsychological assessment in people in need, and we have used it for more than 300 participants. The examinations made by the Athens Alzheimer's Days care centers, not only in Athens, but across Greece. So we see that the neuropsychological assessment is quite a promising way of examining people in need, and now more people have access to neurodiagnostic services.
Okay, thanks, Angeliki. Thanks everybody for being quite brief. So let me see. So I will now try to.
Nico, I'm sorry. I have to go in a moment. I'm so puzzled as to how you do a mini mental. We have not discovered a way to do a mini mental remotely, but perhaps you have a technique that we could learn from.
Yes, and maybe we should devote maybe a separate session and going into the details of what kind of tests are chosen, how they're administered, and all that.
Okay, I don't mean to interrupt, but yeah,
of course. So anyway, so now from my end, I will show you some ways through which we can refer more patients to these telemedicine services. I understand it's still in infancy, so we need to increase the numbers and of course to improve the assessments and capitalize capitalize on experience, our experience and experience from others. So let me tell you about this program a little bit. So it's a program funded by the Stavros Niarchos Foundation. So we visit remote areas in Greece, and it's in continental Greece and in the islands. So overall, it's 58 destinations, half and half. Okay, so how did we choose these? You know, there are these districts of health services in Greece, 7 of them. I will not spend time. We send a questionnaire to, healthcare centers and to different administrative services with different questions so that we can make a map of what's out there. And then we received some answers, and subsequently we decided and we chose these particular areas using criteria like the distance from a hospital, how many services and what quality of services the particular hospital in the city close to the area was able to offer, and then the density of the population. So using these criteria, we ended up with these destinations, and this is where we go. So let me take you now on a trip with us. So first of all, who goes? So it's usually a very big team. It could be 25, 30 people, many medical specialties, but also many technicians, psychologists, dietitians, and a lot of IT support and so forth. So it's a really big team that goes to these visits. And then we have technology support. So there are these 2 big trucks that they're customized so that they include a lot of machinery and a lot of equipment for many tests. I will show you some examples. So you can go into these trucks and have various tests. I will show you what kind of tests. So there's a mammogram, there's a DEXA machine for osteoporosis, there's a dental room, and then there's an digital X-ray machine, and there's space for a gynecological exam. And of course, they carry all the equipment for the ophthalmologist, for the ENT, ultrasound, cardiological ultrasound, and general ultrasound, and then equipment for blood studies, spirometry for the pulmonologist, and so forth. So how do we travel? We travel either by boat or by car. There are these 2 vans, or we travel by boat and we get into the boat for each destination. So overall, we're approaching about 40,000 miles or 40,000 kilometers right now in the continental areas. We go to these particular areas, we set up, we unpack, and then we start usually with ceremony at the religious or the mayor of the area. And then how do we make the appointments? There's an application that we have created in people's cell phones, so they can go online here and they can select a particular destination and they can select the specialty that they want, and they can make an appointment. So the patients themselves make the appointment the days before the expedition. And of course, people can make an appointment on the spot because we set up a secretarial service, and then additional appointments are being made, or those who are not able to make it online, they can make these appointments. Then people sign the GDPR, and then we start examining them at different sections. And there is an electronic platform where we enter all the data. Let me show you how that works. You go online, we have a password, and then this is what you see when you go to the Kalligerou. So you can see here in every column different medical specialties. You can see neurologist, surgeon, gynecologist, and so forth. And then the appointments are there at particular times. I will do this very fast. You can see it's a pretty dense schedule. So then these people come in and we examine them and we put in some notes. We open the particular appointment for each patient. And we can also see diagnoses and notes from other medical specialties or other specialties if we look at a different part of the online system. And then if need, we can order a test. And how do you order a test? For example, let's say we want to order a mammogram. Click on this, and then the patient goes to the track, has a mammogram, and then the patient comes back, and then at the same time in our computer we have the picture of the exam. And of course, it's not only the mammogram, but but it's also the echocardiogram, the simple X-rays, the EKG, and so forth. So all the exams that take place are loaded in the system. And then we put an ICD code with a diagnosis depending on the patient we see. Subsequently, when we finish, all this information, all this medical information is accessed by the patients themselves in their cell phone. So there's an application we have created in the cell phone, or they can go online and they can log on and put their password and they have access to all this information. So when they log on, they see all the diagnoses that they were put and all the notes that were put there, and they can have access to all the exams they had. So if they go to a hospital or if they see their primary care physician where they stay or elsewhere, they can show them all the medical information that was collected during these visits. And then we unpack, and of course we don't go right away. We oftentimes have, parties the same day or another day, and then we leave. So this is the whole idea of what happens. And then this is a schedule. This was for 2019, but it's kind of similar every year. So you can see the different destinations and the different months. We try to avoid the summer months in general. And green and blue is continental or islands. And as you can see there, it's about 25 destinations per year. So it's quite dense. And these are the destinations here. We go back to these destinations on average every 13 months. And there's some destinations where we have visited only once. I just gave some examples here. And there are some other destinations where we have visited 6 times already. You can see Agios Eustratios, Amorgos, Psara, and so forth. It depends on when we started also, when each destination was entered into the system. And we recently celebrated the 10 years of this effort. So it has started actually in 2013. Overall, actually, right now we're 163 missions, I think, expeditions. And we have seen more than 50,000 people, more than 113 appointments, because each person is being seen by more than one medical specialty. And we have performed more than 85,000. Actually, it's an error here. It's exams. Paraclinicas is meant to be written. And you can see some examples of all the exams that we have done. Now, regarding the neurological diagnosis, and most at the end, actually, in most of these expeditions, I have been, but then there are other colleagues that have also participated. Socrates is with us, and Faidra, they have participated in some of these expeditions too. So this is a very, sorry about the typo here, about hypnea, but in any case, this is a rough distribution of the ICD-10 diagnosis. And so overall, in the neurological evaluations, we have seen close to 3,000 participants. And then close to 200 of them are people with dementia, and about 140 with subjective cognitive complaints and 30 with MCI. So these are the numbers. And then from these people with dementia, most of them are dementia of the Alzheimer's type. So over the last few months, in collaboration with Socrates, we are trying to refer more and more of these participants for outpatient clinic here at Aiginitio, where Socrates and his team and Thalia and Dionysia are examining these participants. And we are also trying to push the local physicians to use their telemedicine equipment and to actually go on and do these referrals. And of course, Socrates and his team have access to our information here. So when they are being seen through telemedicine, they can see also what is the information that we have seen when we examine their place of residence. So, okay, and I will stop here. So I think it was a little bit dense, but right now it's time to have some discussion. And I think Socrates has, and sorry, Socrates, I will give you in 1 second. So I guess people can also put some notes in the chat or some questions in the chat if they want to discuss. And maybe we can start. Socrates, please.
Nikos, thank you. It was an excellent presentation. maybe condensed, but I think everybody understood very well the situation. I thank also Dionysia, Thalia, Angeliki, and Faidra for their presentations, very brief. And well, what we have seen is that, in fact, the style of the neurological examination and the neuropsychological evaluation was really in parallel. We use the same tools. I don't see HVLT and Greek VLT is the same tests. So I don't see any, in fact, any difference. At least 90% are the same. It's very interesting, this. And what you have shown was excellent, and it confirms the impression that I have that people with dementia are really under-referenced. I mean, I was expecting in the villages to see at least half of the neurological problems to be cognitive disorders, dementia. When we see the results that you have published with the epidemiological study in Greece about the number of patients with dementia over 65 years, we know that the population in remote areas is mostly old people. So I was expecting to have at least half of the patients with cognitive disorder, dementia, or Parkinson's disease. And what we see from your data is that we have less than 20% of the whole neurological diagnosis were about dementia. So I think that there is a very important lack of reference of these populations. And I think that is the most important thing we have to discuss. Well, I try to be brief.
Okay, thanks, Socrates. I'm in agreement with you. I think there's a lot of potential, we can definitely reach out and get more people, because I'm sure many more people have problems, but not everybody asks for services. But there are many different, battles we have. We can fight, and we have to pick our battles, right? One battle is to try and be able to refer more people to you guys, and then convince the local physicians, and then we can expand on the referral part and many other issues. So does anybody else want to make, because it's not a good idea for us to monopolize does anybody else want to ask us any question or make any comments or any thoughts? And I'm not sure whether there are any questions in the chat or any Mary, you wanted to say something?
Yes, first of all, congratulations to everyone. It was an excellent presentation of really important work being done in Greece. So congratulations to all. I being a psychologist and testing people, I always have the concern about tele-assessment, and obviously it's needed, but at the same time there are many pitfalls, and I was wondering how you were able to ensure that there were no distractions in the environment, in the room where the people were being tested, or an audience, maybe someone from the family, disruptions.
Maybe, I don't know, maybe a neuropsychologist want to comment on that, Dionysia or Angeliki?
Yes, of course, we consider these kind of limitations and we report them. But I think in this case, the strengths are more than the limitations, because both during COVID-19 and now, these are all people that they don't have access to any daycare center or any major clinic. So either they will get this assessment, or they will most likely have nothing at all. Mm-hmm. So of course, yes, I believe that there are these different subjective difficulties that may occur to each participant at any case, but overall strengths are higher than these limitations. And apart from this, even before COVID-19, there were some very scarce, but there are existing papers, literature, showing actually high correlation between specific cognitive tests being done remotely and the actual test. So this is something very supportive and kind of good. So if you maybe if you have planned everything very well, you have a very well organized psychological assessment, and you have either a cognitive healthy participant or someone with a caregiver who can handle our instructions and technology, I think you can get pretty good results, and you can definitely help a lot these people.
Okay, thank you.
Yeah, I mean, I'm also of the same opinion in that, you know, it's not perfect, but it's compared to what? Compared to nothing. So, but of course, we can try to improve. I don't know what's the best way to improve. Maybe to, you know, to talk to the family before the, I don't know, before the sessions and try to ask them, you know, about the best possible conditions in terms of noise, in terms of interruptions, so that we can be, you know.
Yes, and we do that. We do that already. We check the microphone, we check how it works, so we double check that before we start the assessment.
Yeah, of course. Vula, do you have any comments? Do you want to say anything or anybody else?
No, it's full. I don't have any more comments. I agree with Angeliki and you, Nikos, that this kind of neuropsychological assessment is better than nothing. And with this remote assessment, we have reached very villages and small islands which are at a very long distance from any service for dementia. Also from any service for any neurological service. So I think it's a very good and successful way of reaching people and assessing cognitive disorders.
And also people with movement disorders, that they can have also both movement and being on a remote place. So this is a double problem.
Okay.
Absolutely. And there is one more thing that we have some rare cases of rare dementias, like basal degeneration. And we were surprised to find such patients. It's very important because they wouldn't have any chance to be diagnosed in these remote areas. I think it's one more thing about the rare cases.
Okay.
I have one question, if I can have say one question for the neuropsychologists. I am really skeptical whether we can use the advances with the digital solutions or digital tests, which could save really time, or we should stay with the test that we have. Because I was thinking that maybe the neurological testing is a kind of keeping a relation with the patient. So if we use for the evaluation digital testing, then we will lose this kind of human contact. Well, maybe I'm provocative, but I'm really very skeptical about what to choose between them in this situation. I mean, telemedicine. What do you think?
Not to mention the need for the patients to be able to be familiar and have ease in using the technology.
Yes.
But I tend to agree with you that the human contact is a big part of the assessment.
Yeah, I think, yeah, I mean, it's quite challenging because these are older people, but I think, you know, more technological literacy is almost like a cohort effect, because we see more and more middle-aged people to be quite familiar with technology, and this would be quite different in the near future. But beyond that, I'm trying to look more a little bit into the future. So these examinations that are being used, the selection of particular parts of the neurological examination or particular neuropsych tests, if I understand well, they have been validated for telemedicine evaluation, or they have been somehow validated as telemedicine evaluations for a particular population we are dealing with, or neither of the two. I mean, do we need to do some preparatory work on that?
You're talking about the neurological, Nick, right?
So about both.
Neuropsychological, examination. In your paper, I believe that you have validated these tests as telemedicine examination. Am I right, Angeliki?
Yes, I think he started as a neurological, but it's almost the same. There are studies that they do the validation either way, but specifically to ours, because it was a new standard, we did it among these people. So now I think it would be even better if we could also gather, since we have very similar neuropsychological assessment, it would be interesting to check both just like Dionysia and Dr. Papageorgiou protocol and ours, and then maybe we can do a more proper validation as like a neuropsychological assessment, and maybe also examine it's how close it is and validated with the in-person battery.
So
regarding the previous.
That's what I'm asking, Angeliki. So this, in your paper, you validated the use of these tests against the gold standard of an in-person physical neuropsychological evaluation?
Yes.
Happened around the same time?
Right before.
Right before. Okay, so that's great, because not only do you validate the test, but also you validate it in the population, more or less, so in a Greek population, because it may be different, in different ethnicities, cultures, and languages. So that's very useful.
Yeah. But in this case, it's not a matter of validating the test in the population. It's a matter of validating the test, which is being administered over the telephone or the internet or whatever. So, because most of the tests were not created for that purpose. So then you need to be able to be sure that when you're using them remotely, that you're getting accurate results, that the scores mean the same thing as if they were tested in person. It may be a detail, but it's good to.
So you're saying that even if the scores that you get in person and online are similar, they may not mean the same thing?
Well, I don't know. It's an empirical question.
Right.
Yeah. Because I understand that the cost of doing a remote assessment is the benefit of doing a remote assessment is higher than the cost. The cost meaning any inaccuracies that might result. But then again, certainly we don't want to overdiagnose. So I'm not saying not to do it. I'm just saying that there's things that we have to consider. And I know the early literature on remote neuropsychological testing was based on testing people who were far from the neuropsychologist, but were in an area where there was another health professional or a trained psychometrist who could kind of assist in the whole process and ensure that there was the quiet environment and all that. So it's not necessarily the fact that the case that all remote assessment is done in someone's home. Sometimes it's done in another health center somewhere else where the neuropsychologist can't get to.
Right.
And there's differences in all these cases.
Okay. And what about the neurological assessments? Are these, because I mean, I'm not sure. I missed it. I mean, it just they are recommended by somebody, or it just makes sense to choose these assessments because intuitive understanding.
Okay, I found the paper, and based on this paper, I mean, there are restrictions. You cannot make a full neurological examination using telemedicine. There are aspects that cannot be examined. But when you examine a patient referred to you for memory problems, I think these things I mentioned, these basic things, is a good start. And of course, as I also said, if for any reason you think there is something more, you just refer him for an in-person examination. But basically, eye movement, bradykinesia, speech, coordination, and walk, I think it's enough.
But we're asking something different. Where are they coming from? Are they coming from a literature that says that these are equally good when they're administered in person or from a distance?
I'm not sure about that.
Thalia, I think she has done a lot of
In comparison, I'm not sure about it.
Could you comment on that?
Yes, there are some studies regarding some specific scales for patients with Parkinson's disease. For example, the UPDRS Part 3. As I said, that it has been shown that it is reliable. The remote performance of this examination is reliable remotely compared to the in-person settings. And there is also evidence that if we Yes, if we cut the parts of rigidity and the pull test that we can't do remotely, then the UPDRS Part 3 can be also used without these parts reliably. There's also this evidence. So, in addition, there is some literature evidence regarding the fact that some subtle mild tremor, for example, or some subtle dystonia movements depend on the quality of the internet connection and the quality of the image and on the screen or in the camera. So some mild cases are more difficult to be assessed reliably online. And these come from some comments from the experts. There are some papers on expert opinions, commentary, something like that they comment on these things. Regarding the studies, there are some things regarding scales, like the UPDRS Part 3.
Yes, but we are talking about a scale for a specific kind of disease. I mean, I perform a general neurological examination. I'm not using any scales when testing, when examining people at the Athens Alzheimer Association.
Yes, of course. I'm talking about the UPDRS Part 3 when, for example, a patient with suspected...
no, it is good, but I mean, we don't have some kind of scale for people with memory problems.
Yeah, okay.
Yes,
I think what Thalia is trying to say is that, when you test the bradykinesia...
Yes, I understand that it is validated and it can be used safely using telemedicine.
No, I think she's saying that when you use it, since it has been validated as part of the UPDRS, it's clear that, it makes sense that it's a tool that part of the neurological examination that we can use, and there's work to be done for the rest of the neuro exam. In any case, I think we have approached the end. I don't know, does anybody else want to ask any question or make any comment? Okay, great. I think we can... Yes, Ula?
I want to say that during the pandemic, I think it was 2020, 2021, the guidelines of the American Academy of Neurology for remote examination of dementia papers, and especially regarding the neurological examination, mentioned that the parts of the neurological examination administered through these guidelines were equally reliable, both in person and remotely. They proposed a protocol for examining not a whole neurological examination, but just the part of it we use for dementia papers, for dementia persons, for people with memory problems, cognitive problems.
Okay, that was what the question was about, Vula. Okay, thanks. Okay, anybody else has any questions or anything? Okay, so I thank everybody, and I hope it has been helpful, and maybe it's a start, maybe for collaboration towards development, maybe of a unified tele-assessment protocol, and maybe towards referring more and more participants so that we can offer more services over and above the COVID or any other pandemic. Maybe we can offer services to people who do not have access. Okay,
this, in fact, sorry for interrupting, this in fact is the biggest part of our work for the ELITEC project. So I want to thank you in advance for your collaboration that we are going to have with a focus group we are creating with the collaboration of people who are doing telemedicine in dementia. Disorder. So thank you in advance.
Okay, great. So I thank everybody, and if nobody else has any other comments, take care, good night or good evening, depending on where each person is. Okay.
Thank you.
Bye.